by the Uganda Communications Commission. Issues at hand. Issues at hand.
Well, a very good morning, Church of Uganda Family TV, dear viewers. Today is 4th of February 2026 and it's the World Cancer Day. And today this is Issues at Hand. My name is Andrew Twahira, taking you through a discussion about cancer today. And of course I'm joined by a team from Mulago Neonatal and Women Hospital. So we'll be talking about how we prevent cancer. We all know cancer as a disease, but as a disease, and yes, in January as a country, we always we consider and talk about the cancers that are caused by HPV, and by this we mean cervical cancer, we mean cancer of the throat, cancer of the anus, cancer of the penis, etc. But today our focus shall be about cancer of the cervix, or what you can call cervical cancer. And I'm joined by two beautiful ladies from Mulago, and one is Dr. Judith. She's a senior consultant and gene and oncologist. She's also a mentor. Basically, she does mentoring girls 13 plus about these diseases that of course come and hinder them. Another one is Sister Nsambya Beatrice. She's also an oncology nurse from the Uganda Cancer Institute. She's a nurse. Good morning, Miss Judith. You're most welcome.
Thank you.
Good morning, Miss Beatrice. You're most welcome at Church of Family TV. And today we are going to start our discussion with cancer. Cancer, we hear cancer as a word. Most of us, when we hear cancer, we think of wounds basically on the skin, but there's way beyond cancer of the word we hear. So, Miss Beatrice, I'll start with you. What is cancer?
Good morning, viewers. They've already introduced me. I'm Beatrice Nsambya. Cancer as a gene, it is very wide. But in brief, those are abnormal cells which outgrows or which are affected by a virus, then they outgrow, then they become abnormal.
Oh.
But it is a very wide
So basically,
topic.
they are cells in our body, but they outgrow, then they become abnormal.
Once they are invaded by a virus, they outgrow and they become abnormal.
Okay. Now that takes us to our topic today, and that is cervical cancer. Cervical cancer is part of cancer. Miss Judith, what is cervical cancer?
Thank you. Good morning, viewers. So, just to emphasize the point that cancer is definitely, it's a disease that very many people, everybody fears cancer. The moment you mention cancer, discussions become difficult. And just like Sister Beatrice Nsambya said, cancer in a very, very simple way is just abnormal growth of cells. I will say that cells are, we can consider cells are the building blocks of the body. Every organ in the body, every part of the body is a collection of cells together. And you can think of them like bricks in a house. They're the building blocks of the body. Now, when we come to cervical cancer specifically, every part of the body can be affected by cancer. Any part of the body that we see, whether externally or internally, can be affected by cancer. So cervical cancer in particular refers to a cancer that affects the cervix, which is part of the womb of a woman. Just follow with me on the pull-up here. This is just a diagrammatic representation of the internal reproductive organs of a female. This is a diagram many of us have seen before in science,
Yes.
where you have the uterus in the middle, you have the tubes on either side, there are 2 of them, and you have 2 ovaries that are attached to the ends of the tubes. Now the cervix is the lowest part of the uterus, sometimes referred to as the mouth of the womb. And this is the part during labor and delivery that will open to make way for the fetus that is usually inside the womb to come through. So we do not see the cervix on the outside, but we are able, using some tools, to gain access to this. It's at the upper part of the birth canal, as you can see. So this is the cervix. So when we talk about cervical cancer, we mean cancer that affects this part, and therefore when the cells that make up the cervix grow abnormally over a period of time, then you get cervical cancer. However, it's a very special cancer because it's one of the cancers that that comes as a result of infection with a virus that is very common. You may have heard of the human papilloma virus, abbreviated as the HPV. Yes. So that is the virus that actually causes cervical cancer.
Okay, thank you. So as we've heard, cervical cancer, basically you can't just see it on yourself, like let's say it's on a clear skin. You have to first be checked, then you get to know that you have cervical cancer. So with that means that it's a big problem. So how far have we gone, or what is the burden in Uganda, or what is the prevalence of cervical cancer?
Thank you very much. So when we talk about cervical cancer and all cancers generally, we usually measure them in terms of how many women are affected by the disease in amongst 100,000 population. So Uganda is one of the countries, Uganda and other East African countries, generally East Africa as a region, we have some of the highest incidences. It's referred to as the incidence of cervical cancer. And ours is 40 per 100,000 women and above. Actually, some data will say that it's even more than 50 per 100,000. And that means that if you take 100,000 women randomly, about 50 of these women will be affected by cervical cancer. This may seem like a very small number, but any of you who have interfaced with women who have had the disease will realize for that particular family that is affected, it is 100%. It changes their way of life and everything, because the majority of women affected are still within the prime of their life, when they are productive, when they should be serving their family, they should be contributing to the community, building the nation.
Yes.
So in Uganda, in the world, cervical cancer is the 4th most common cancer, but in the Uganda specifically, it ranks highest. It is the most common cancer amongst females, followed by breast cancer. Now, the issue that is very disturbing is that for the majority of the women who present with cervical cancer, they come in late and they end up dying over time. So we would say out of those 40 women we were talking about, maybe 30 of them, that's 3 out of 4, will die. So it is a very big problem.
So that means that as we see women, we are in Kampala, you can see women walking. That means for 100 women you pass, 50 of them might be having
100,000.
100,000, yes.
Yeah.
Okay.
Yes.
So I'm coming to you, sister. So what could be the causes of cervical cancer? I've had cancer that it is quite in number, growing in number, more so in Uganda. So what could be the causes of this sickness?
Thank you. Of course, as we've already said, the causes, okay, it is caused by HPV.
HPV, yes.
But how do we get the HPV?
Yes, how do we get it?
So it is sexually transmitted. It's the men who are transporting it.
Oh,
Yeah. But even men get it from women. Yeah. So that is the main cause. Okay. But we can also get it like people who are HIV positive. Those are the people who are likely to get it because of the low immunity.
Immunity, yes.
Then someone who has delivered many children, she's also prone to get cervical cancer. Smoking, there are some people who are smokers. So they are like ladies who are smokers. They are likely to get it. But again, provided you are sexually active, you are at risk of getting cervical cancer. Yes.
So, before we move on, you've said that it's mostly men who spread it.
Yes.
So, what is its effect on men? So, we've not seen men. Okay, I don't know the number of men who have it. I don't know if I have it. But if we say that men, they are the most carriers, or who do spread it, does it also affect them, or can we see the effect on them?
For the men,
yes,
it doesn't affect them. Of course, they can get penile cancer, but it is a different HPV which causes penile cancer.
Yes.
For HPV which causes cervical, doesn't affect men. But it can affect them in a different way. Yes.
Okay.
Like it can cause cancer of the throat. Yes. But for that, they can't get the penile. Before we come to that, there are so many types of HPV, more than 100 types. Okay. Each type of HPV causes different type of cancer,
yes,
and different site. Okay. For HPV which causes cervical cancer, there are only 3 types, though there are others which may also cause, but those are not directly. Yes. So they don't affect the men because they don't have the cervix.
Yes.
Yeah.
Okay, now I know, and I know my viewer also know. So as you've said, so is it that the people who are most at risk, those who have HIV, as you've said?
Every woman, provided you are sexually active,
yes,
whether it was just once like this, you can get HPV.
But who is mostly at risk?
The most ones are those multiple sexual partners, HIV positive, the smokers, run mortality, STIs. Once you've been getting frequent STIs, you can also get HPV. And not all HPV, not everyone who gets HPV will get cervical cancer. No. It is the persistent HPV which causes cervical cancer.
Okay.
You can get HPV like last month, but because of your body immunity, you fight it and it clears. And again you get another one. It clears. But that one which causes cervical cancer is the persistent one. It has failed to be. It stays. It has failed to be cleared. Yes. So that it is the one which causes cervical cancer. You can say you can get it like last month, but don't expect to get cancer next month or in a year. Okay? It can take something like 10 to 15 years. You are having your HPV in the body. You are moving with it. You don't know. Yes. The body has failed to clear it. So within the 10 to 15 there, it starts to make some changes. That's when you see the effects. You may not see them immediately. Yes. Actually, when it has just started, when the changes have just started, you'll be very normal like us. You're moving. You're continuing with having sex and you don't know. Exactly. Okay. By the time you start getting the symptoms, it has already moved. Yes. And it has raised in number in your body. Exactly. Okay. So
as we hear, that is deadly. So how can we prevent cancer, and how do we do that?
Yeah, cancer can be prevented. First and foremost, how we can prevent it is by screening or checking. You go to the health provider, look at your mouth of the womb. You know the cervix is very far. This is what we use. It is very far. Where it is, as she showed you there.
Yes, yes.
So we use this small instrument of ours. We insert it inside your private parts so that we can see the mouth of the womb.
Of the womb, yes.
If we don't see this, we don't use this, we can't see it. And no one else, not even your husband, not even you, can see it without using this. Even us, we've never seen ours. Okay? So, we look at, you can't know. That's what I've said. The changes may be small like this.
Just simple blood.
Not blood, the white. This white happens when we've put some medicine to check. So you can't know that you have cervical cancer or you have changes, because we start with the changes. From the changes, then we go to cervical cancer. Okay, so the signs are not there when we've just when it has just started.
Yes.
That's why we are encouraging the screening to prevent cervical cancer. There is also immunization against HPV.
Yes.
It is on the government program. So when you immunize the young girls from 9 to 14 years, we are preventing them from getting
this virus.
That virus,
yes.
HPV. Then also being faithful to your partner. If you have 4 wives, be faithful to the 4. Even the wives, let them be faithful to the one husband they have.
Okay.
Yes.
So basically it moves through sex. It is an STD.
It is, yeah.
Okay. So I'm coming back to you, Miss Judith. Yes, we've had you do screening, but how do you manage those with cervical cancer? Let's say, I'll give an example. I've brought my wife and you found out that she has cervical cancer. So what is the next step?
Okay, thank you very much.
Yes.
So I want to take it a step back. We've talked about infection with HPV,
yes,
as the main cause of cervical cancer. That is known through research, and as Sister Beatrice had said, the main types are 16 and 18. Those are the commonest types that cause a very large percentage of cervical cancer. So there's something that we call the pre-cancer stage, okay? And that is the time when the cells have been infected by the HPV, and then they are continuing. The HPV enters the cells and begins to drive them in an abnormal way. If you can focus onto this, this is just a diagram also that shows what happens. So at the top, you can see that these are the normal cells, and when we look at the cervix, we should have a nice smooth surface just like this, okay? This is what a normal cervix looks like, nice and smooth. Now, over a period of time of being infected with HPV, the cells begin to multiply much faster than usual. And in that process of multiplying much faster than usual, you begin to see abnormal things in the cells, and that's what she was talking about. That is the screening bit of it.
You see it through screening.
Yes. So when we go to screen, because the process of developing cervical cancer, like Sister Beatrice said, is a very long process, and it is that persistent HPV that over time causes what are just abnormal cells. When the cells are abnormal, you only know they're abnormal when you do the screening. And when we apply medicine, which is actually vinegar, like your table vinegar you use for making salad. That's what it is. But the one we use for screening is specially prepared. It is diluted to a certain, percentage, so that it's not very painful to feel when we put it on the cervix. So those abnormal cells infected by HPV, if there, will turn white, and that is what we see at screening. But at that point, it is not yet cancer. It is not yet cervical cancer. It's just abnormal cells. But which cells, if not treated over 10 to 15 to 20 years, will progress to become cervical cancer. Yes. So when we screen ladies and we discover that they do have those abnormal cells, if you screen them with vinegar, there's another test also that the WHO, World Health Organization, now recommends. It is what they call a high precision test. It's very accurate, and therefore it can be used for screening at longer intervals. You can go for 5 years before you do another screening. Yes. So it tests for the DNA of the HPV, of that virus. So when we do that and we find that you're positive, then we proceed to treat those abnormal cells. So what is commonly being recommended now is that we treat them with heat. There's a special machine that we have that we put onto the cervix, and in that particular area we just use that machine and we place it onto the cervix for some time, and it applies heat to that area where the abnormal cells are, and once that happens we destroy those cells. So if you destroy the cells with heat, then over time they will not progress to cervical cancer. In the past we used to use cold, use actually a machine that would apply ice and very cold temperatures to destroy those same cells. There are a few centers that still use that, but we are generally moving away to use the heat treatment instead. Then in some few women who have abnormal cells that really cover a very large area of the cervix that you cannot treat with the heat, then we go in and use a special machine and process, and we actually just cut out the area where the abnormal cells are. So this is a daycare procedure. You can walk in and just have it done, or it may have to be done in theater sometimes. So that is how we treat the abnormal cells before they become cancer. However, if a woman is screened and we find the actual cancer, which will now show up like abnormal growth, an abnormal growth, you can look at the chart. Okay, so the chart down here, these last two pictures here show you what happens. Once when cancer, the woman has cervical cancer, the cervix is no longer nice and smooth, okay? Like we said, it is now very, it looks distorted, there is bleeding, there is a discharge, and because this is the cervix and we know where the cervix is located, one of the symptoms that women will present with is bleeding on contact of the cervix. Anything that touches the cervix, whether it's during sex or if they touch with their fingers during douching, then they will notice bleeding because there are already wounds on the cervix. It is already eroded. So depending on which stage the cancer is at, the treatments will differ. If it is early cancer that is just limited to the cervix alone, and the lesions, the wounds are very they are small in size, we can perform surgery, and that surgery will remove the whole of the uterus. Okay? If it is a little more advanced, it moves from stage 1 to stage 2, and that means that it's beginning to move beyond this cervix to the other areas surrounding the cervix.
Yes.
In most cases, we may not be able to perform surgery. Okay?
Oh, yes.
Yes, then there is a stage 3 where it goes beyond this cervix, beyond the uterus, and it may reach the bones of the pelvis. Okay, the hip bones may be affected. And then stage 4 is the last stage where even other structures.
So, Dr.
Yes.
Judith, hold up there. We'll be going for a simple break. We are still continuing with the discussion about cervical cancer until 10. But for now, let's go for a simple commercial break. We are continuing with the discussion. Thank you.
Issues at hand. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand.
Well, welcome back from that short break. We are still continuing with our discussion about cervical cancer. Today is World Cancer Day. It's 4th of February, so it's celebrated on 4th of February of every year. We are still with a discussion with Dr. Judith about stage 4. Stage 4, she had explained about stage 3, about the first stages, the second, and now there is stage 4. So Dr. Judith, so as you've explained, stage 1, stage 2, stage 3, stage 4. So stage 3, someone still doesn't know if before she's screened, she doesn't know that she has HPV. So let me ask you this question. You've said you screen, that's when you find out that someone has HPV. But can someone have the similar symptoms of this virus, or of this virus when it's another STD, before you come to a conclusion that she has cervical cancer?
Yes, definitely. Remember, we said that HPV in itself is a sexually transmitted infection, and one of the risks for cervical cancer is having other sexually transmitted infections. When you do have other sexually transmitted infections, the common ones we know, there is syphilis, there is gonorrhea, there's one called herpes that gives you that will give you, like pimples and small wounds on the private parts. Yes, and there are others. But once you have these, they make the cells of the cervix, the lining of the birth canal and the cervix inclusive, become very weak. They're already damaged. So if HPV also joins them, it easily gets into the cells. So yes, you may have other diseases, other sexually transmitted diseases. But it also makes it open for this virus. Yes, it makes it easier for HPV to get into your cells. So when we do screen women, we ask about many other things as well. When we encounter them, we ask after the sexually transmitted infections. And just to emphasize that not everybody who gets HPV infection gets cervical cancer. The body has natural immunity to clear, to defend itself and deal with this HPV virus, infection. Within 2 years, once you start being sexually active, engaging in sex, you pick the virus. It's actually very common. I would dare say that it is the most common sexually transmitted infection, just that our bodies are able to clear it. So it's just a small percentage of people, about 5 to 10, maybe not more than 15% of people. So every 5 or 10 people out of 100 will fail to clear the virus, and it will persist, and then it will lead to all these things we talked about.
Okay.
Yes.
So that ranges from their immunity or from their blood groups. There are those that can fight it faster and...
Well, I will not say that it has anything to do with blood groups. Yes. But generally what we do know is that for people who have lowered immunity, like those who are living with HIV and AIDS, they have a tendency to not be able to clear the virus.
So now continue with stage 4, as you're saying this.
So as we had mentioned, the stages are 4. Stage 1, to note, is that in most cases we are able to operate and cure you of cervical cancer completely, but then you'll have no womb left for you to have more children. Stage 2 and stage 3, it has moved a little bit more. Okay, so by this time we are already talking cancer, so it's no longer abnormal cells. So we are able to see, what we showed you, that there are wounds in there, and discharge, bleeding and everything.
This is exactly cervical cancer.
Yes, this is definitely cervical cancer now we are talking about. Now stage 4 is the stage, it's the last stage, and at this stage it affects other organs that are close to the cervix, which are the intestines at the back, and in front the bladder. So in front of this uterus is the bladder, and behind it are the intestines that eventually end up as the anus. So when those two are affected, you begin to have, you may have a woman may notice that she's passing blood in her urine because the cancer has gone to the bladder. When she goes to the bathroom to ease herself to release stool, it may be blood stained. So that is stage 4. Now, much as stage 2, 3, and 4 sound like we cannot operate, there are other treatments that we can give, and we have a machine that can, let me just put it in a very simple way, that it burns the cancer out of your body. It is similar to the machine that generates x-rays. When someone has a fracture, you think they have a fracture, we put them into that machine and we take the x-ray. So these ones are similar, what we use to treat these rays that we use to treat. So it's a machine that we use to treat the cancer, and you cannot see the rays, but you have faith that they are there, they are working.
They are working.
And
yes.
the evidence that they are working is that the woman begins to notice that there is less pain, the bleeding begins to reduce, any kind of discharge she had that was abnormal also reduces. So let people not, of course we are saying that people need to come forward and screen. We really have an opportunity to eliminate cervical cancer completely, because we have a very long window period during which it's just the abnormal cells waiting to progress. But if we can interrupt that process of the abnormal cells and treat them, then they will not 10-15 years down the line become cervical cancer. And that is the simple essence of screening.
Okay, so I'm still with you, Dr. Judith.
Yes.
From stage 3 to stage 4, now you've known that this is cervical cancer. So from that moment, the process you've said of a burning with rays, can it also work on that stage and someone gets cured completely from stage 3 and 4?
Yes, actually we normally, it can be used even for people who have stage 1 disease, stage 1 cervical cancer, and who for certain reasons, either they are very weak, they have medical conditions, or their surgery will be extremely difficult and risky to undertake for any individual reasons. You can also use the burning process to cure completely stage 1. So it can be used for all the stages, just that the amount of the treatment given, the duration, will differ based on which stage it is. As we move towards stage 4, we are treating them for a little less period of time, because the treatment itself damages not only the cells with cancer, but also some of the normal cells in the body. So there are some side effects that come with that treatment process of burning.
Okay, now this is burning. Burning feels safest. For us who grew up from the local Uganda, we know that when someone gets cancer, let's say on a hand, the hand gets cut. Let's say it's a finger, it's cut to prevent it from spreading. So from that moment, we know that any violence, when it's cancer on the body, they remove it. The body which is infected, then they put a new one. So for cervical cancer, you said you burn it. Is there another way of preventing it, or it's just burning?
So what we are talking about now, the burning, this is treating. Okay?
Yes, treating, yes.
So for all cancers, wherever they are in the body, there are 3 main ways of treatment. One is to do the surgery you talked about, the cutting away of the part affected by cancer. And generally speaking, surgery can be done when the cancer is detected early, and usually with very good results, so that the person is totally cured of the cancer and it does not spread to any other part. The second method of treating cancer is the burning that we talked about. And the third one, I will call it drowning the cancer cells in what we call chemotherapy. Chemotherapy is simply medication that is usually given through a drip. Sometimes it may be through injections or tablets, but it is given and it goes into the blood system and it locates the cancer cells wherever they are in the body. And like I said, I called it drowning just because it's, it is a lot of chemotherapy is liquid. But yes, so those are the 3 ways. Now, not every cancer is treated with the same way. Okay, surgery is, yes, it is, if the cancers are detected early, you can operate. But as for the burning and the drowning chemotherapy, it will depend on which particular cancer we are dealing with. I'll give you an example. Cancer that affects the ovaries, okay? These ovaries, where our eggs come from, okay? Women who have cancer of the ovary, you usually see them, they start complaining of, I feel so full when I eat a little bit, my tummy is so full, and within a short period of time, the abdomen is distending, you might think she's pregnant with twins, and the ovary can grow to a very, very big size.
That is also cancer.
Yes, that is also cancer. So cancer of the ovary generally is treated by surgery and also by the chemotherapy. Not the burning. So the burning is more specific to cervical cancer.
Yeah, and it's more preventive to prevent from spreading further.
There are all ways of treating the cancer to stop it from spreading. But once when the cancer has gone to stages 2 and particularly stage 3 and 4, it's really like spread. Okay, it has spread beyond the area where it started. And there is a term we use where we are now just improving. It's called, palliative care and treatment. We are just improving the quality of life, trying to extend life, but we may not necessarily cure the cancer completely.
Okay.
So that is why we are really calling out to people to get screened, because the time you come to us with the cancer, it's very difficult to treat. It uses a lot of resources. It is very painful for the person affected and the family affected. And even us, the health workers, we get stressed and emotionally we feel sad because we know that we most likely will not treat our patient. We'll just keep on improving quality of life, manage the pain, manage her bleeding, get her feeling a little better. But at the end,
there's no cure.
Yes.
Okay. So coming to you, sister. Yes, we've heard that you do screen. Then after screening, that's when you find out that this person has it or not. So these services around in our communities, the services of screening, can someone get like the services? You are from Uganda Cancer Institute, but let's say someone is watching us from Masaka or Mbale or any other area, not a city or from a local village. How can she find these services?
Actually, I'm from Women's Mulago Specialized Women and Neonatal Hospital.
But we work with Cancer Institute as well.
Yeah.
Okay.
The services they are available, health facilities. You just walk in, ask for where they screen cervical cancer from, they work on you.
Oh, so
they are available. We have different methods we are using now. Of course, the first one, as doctor said, we use vinegar.
Vinegar, yes.
We apply it on the mouth of the womb to see whether there are some abnormal cells.
Yes.
Then we have another method of a pap smear. This pap smear, it picks the cells from the mouth of the womb. It picks the cells from the mouth of the womb, and we put it on the glass slide.
The microscope.
Yes.
Okay.
So it will tell us whether there are some abnormal cells. There is another one, the brush, which we give to the mother to insert in her private parts. She rotates it and gives us back the brush. Then we take it to detect the HPV. Yeah, so those are some of the screening methods we are using now. They are available in most of the health facilities, whether you are in Masaka Regional Hospital, Kalisizo, all those hospitals in Masaka they have. Well, if you are in Gulu has even Cancer Institute in Gulu. Even Gulu Regional Referral they are doing. Actually, in all health facilities, government health facilities, even the private ones, Mengo Hospital are doing it, Lubaga Hospital are doing it, Women's Hospital we are doing it. Okay? If you are around here, you can come to Women's Hospital. All these services are there.
Okay, thank you so much. So as we are concluding, any word of advice from you, Dr. Judith, to our mothers, our sisters, who might be moving with cervical cancer or any abnormal virus when they don't know?
Yes, thank you very much. So just as we said, screening
Okay.
to our mothers, our aunties, and the older people who are already sexually active. If you have daughters aged between 9 to 14 who are not yet sexually active, please bring them for
screening.
not screening, but immunization with the HPV vaccine. We are currently giving just 1 dose is enough, and that will protect them. And for the men, please, we know you don't have a cervix, but you know people who have a cervix. Please support them to come for screening.
Oh, thank you so much. And from you, Sister Beatrice?
I'll just, actually, we didn't talk about the signs, I think, but if a woman there, you are an elderly woman, you had already stopped your periods. If you see any slightest bleeding, let it be just a spot like this. Please come to the hospital. We look at you and see what's the cause. Because in most cases, when you had already stopped bleeding, we don't expect you to bleed again.
Okay.
Once you stop your periods, that is it. So if you see any spot, please come to the hospital. If you get any discharge, anybody you are having a persistent discharge which has failed to clear on all the treatment they have given you, please come to the hospital and we look at you. Don't sit there, don't die from there. We are here to help you.
Okay, thank you so much, my panelists. That wraps up our discussion today about cervical cancer. We are still continuing with our different shows, and of course, it's World Cancer Day. We will continue with similar discussions, but on different topics. This was particularly cervical cancer. As you've heard, go for screening. If you have young girls aged from, as she said, from 9 to 14, get them vaccinated with HPV and prevent them for the future problem that may come to them. And if you're a man, as you've heard, you control yourself, be faithful as you've heard. And with that, I'll wish you a very wonderful day, World Cancer Day. Move with it. If you're a woman, please take this day. If you can't take a day off, go and for screening. Thank you so much. Have a great day.
Issues at hand.